What is a pandemic, and why do we need to think differently in a pandemic? A pandemic is an infectious and contagious disease that has spread across multiple regions, countries, continents, usually ending up affecting the global population. We have experienced numerous pandemics throughout human history, such as smallpox, tuberculosis, the 1918 influenza pandemic, often called the Spanish flu, and the deadliest, the plague or the Black Death. Current pandemics include HIV/AIDS and now COVID-19. The World Health Organization, WHO, classify infectious diseases into 6 phases to determine if an infectious disease is capable or has become a pandemic. Phase 1 is animal-to-animal infection, meaning it is uncertain the probability of a pandemic is likely to occur. It's contained within the animal kingdom. Phase 2 is animal-to-human infection. This is still considered that a pandemic is low probability, but there is a pandemic threat. Phase 3, sporadic and clustered cases of humans being infected, but it's not sustained at community level outbreaks. It's still classified as uncertain probability of a pandemic. Phase 4 is the sustained community level outbreaks. This is now medium to high probability of a pandemic occurring. Phase 5, this is where it's sustained in 2 countries in 1 WHO region. So there has been an infectious spread. This is now high to certain probability of a pandemic. And phase 6, this is where it's sustained in a country and also now in another WHO region. At phase 6, the WHO classifies a pandemic as in progress. COVID-19, as we're all aware now, has been classified as a global pandemic. The WHO also classify the stages following a pandemic as post-peak, that's where the levels drop below the peak in most countries. Possible new wave, that's where activity is rising again in most countries. And post-pandemic, this is where levels of infection return to ordinary seasonal levels. While it's vital to understand where the pandemic is in classification, a wider understanding of the pandemic and its impact is equally important. Pandemics, by their very nature, is a rising tide disaster. And unlike a sudden impact disaster, such as an earthquake or a tsunami, the impact starts at a low impact and remotely and rises over time. This can often lead to complacency on behalf of those charged with emergency and with emergency preparedness. As a rising tide disaster, the nature of the impact is very different from other sudden impact disasters, as the impact is not limited by geography or limited by a single event time frame, such as an earthquake or a tsunami, and is dictated really by the availability of the hosts. In this case, us, human hosts. The impact continues to spread and rise until the population gains herd immunity, either through a vaccine or sufficient spread within the global population. This means that the timescale of the disaster far outweighs a sudden impact disaster, and this pandemic event can last months or years, affecting and continue to adversely affect the whole global population. The long-term impact of a pandemic can be incredibly significant, causing medium to long-term adverse impacts and significant implications for global health. Often we don't know those true implications at the beginning of a pandemic. The impact of a rising tide disaster cannot be underestimated. And emergency response planning needs to fully recognise the unknown nature on the population of a previously unknown pathogen and how that affects normal social activities, while some impacts leading directly and non-directly to mortality. So what do we mean by that? What we mean is that there is a known impact from a pandemic and there is an unknown impact from a pandemic, and we will not fully know what the unknown impact is until the pandemic is over.